influence. And so anyway, I'm so gratified to hear you say that, because I still don't know what the answer is, but that's what we're trying to get at. Anyway, anyway, about 20 seconds. See you on the radio.
Support for NPR comes from NPR stations. Other contributors include
Welcome to Maine Calling. I'm Jennifer Rooks. We continue to see high numbers of COVID-19 cases and hospitalizations in Maine. At the same time, new treatments are on the horizon, and so are booster shots. Today, we're going to learn more about the state of the pandemic with Dr. Nirav Shah, director of Maine's Center for Disease Control and Prevention. We are taking your comments and questions. Dr. Shah is here to answer them. Send a brief email to talk@mainepublic.org. Again, talk@mainepublic.org. You can find us on Twitter, Facebook, or Instagram, or give us a call, 1-800-399-3566. And please note, today's program is also being live streamed. You can view it at Maine Public's YouTube channel or on Maine Calling's Facebook page. Dr. Shah, welcome back to Maine Calling. I was looking back through our records, and I think it's been 24 times since you came to Maine that you've appeared on Maine Calling. We are grateful for all the time you've taken to keep us updated. And here we are, October of 2021. I know that we had no sense that we'd be where we are right now. Please give us some good news, and actually tell us the truth, but I hope it's good news.
Well, Jennifer, it's great to be back on Maine Calling, and it's great to be able to speak with and hear from people all across the state. So here's where we are, both good and less good. Right now, across the country, there has been some degree of easing of COVID-19, and we've started to see that just a little bit here in Maine in terms of our numbers. For example, our positivity rate as of this morning stands at 4.3%. 2 weeks ago, it was 4.75%. Right now in Maine, there are 192 people that are hospitalized. 2 weeks ago, there were 214 people hospitalized. So we're starting to see that easing occur. At the same time, we're continuing to make progress on big efforts like vaccinations. In fact, our vaccination rate is up 84% over the past 2 weeks, driven largely by our work around getting folks their booster shots. The question on the table is, where do we go from here? Let's hope, of course, that those signs of easing that we've seen in other countries, as well as in the southern and southeast parts of the United States, let's hope that those work their way and make their way to Maine. The question is, to what extent and to what degree of permanence? Will Maine go the way of, say, Iceland, where cases spiked and then rapidly came down? Or will Maine go the way of, say, the United Kingdom, where cases also spiked, came down, but still remain at a very high plateau? That's the question on the table. Now, I don't mean to give COVID too much agency over us. We have a high degree of control over where we go with respect to COVID. And the biggest factor driving that is how many more folks get vaccinated. We're making good signs of progress there. In fact, today, we may cross the 1 million mark, 1 million Mainers who may have their first dose on board at some point today. But we've got to do more if we really want to get a handle on the virus going forward.
Some big news in the national news. First, let's talk about the news that Merck may have a powerful antiviral drug. Tell us what you know about this and what it will mean for getting control of this pandemic.
Well, you use the right word there, Jennifer, which is may, because the data that we have thus far about this new drug, molnupiravir, comes from a press release that the company issued on Friday. You and I have talked previously about how I don't like to do science policy, let alone prognosticate on the basis of press release data from the company itself. These data need to be published, they need to be peer reviewed, they need to be vetted by the FDA, and the CDC needs to kick the tires. Then and only then will we have a sense of what this drug's true potential may be. But the early signs that we've seen from the company's own data suggest that the drug may be useful for its primary purpose of keeping people out of the hospital. It seems to reduce the likelihood that someone in the early phases of COVID will need hospitalization by 50%. Now, that's a good thing. There's no question about that. But the question there is, how does that stack up against, say, the vaccine? Vaccines do an exquisitely better job of keeping people out of the hospital. So this drug should not be viewed as a substitute or a bank shot for not getting the vaccine. Getting the vaccine remains the best way to reduce your risk of needing to be in the hospital, needing to be in the ICU. But for those who don't, or perhaps even for those who do, and whose body may need a bit of an assist, this drug seems to show promise. We'll learn a lot more once those scientific steps that I outlined start happening, and that's going to be happening over the next several weeks. So there will be much more to come, but please do not take away that this drug is a reason not to get vaccinated. It will definitely not be of that nature.
All right. Other big news right now from J&J. J&J expecting this week to, from what I understand, and Dr. Shah, correct me if I'm wrong, ask for FDA approval for a booster for its vaccine. Do you expect that to happen? And if so, do you expect to see a lot of people showing up for a booster shot of that?
Well, this month in general, Jen, is going to be a pretty big month on the vaccine policy front. The FDA has already scheduled meetings to review and debate the evidence, not just around J&J's booster, but also around the data for boosters for those who got Moderna, to say nothing of mixing and matching these vaccines. And at the end of the month, something I'm sure we'll go back to, which is the potential authorization of the Pfizer vaccine for kids 5 to 11. Let's zero in on the FDA's work on J&J. First of all, the J&J vaccine has been a mainstay of our work here in Maine. It's ideally suited for places that don't have the ultra cold refrigeration that the Pfizer vaccine requires, and it only requires one shot, which makes it really useful for folks who want to get protected and then move on. I do expect that there will be folks who do wish to get the J&J booster, even though the J&J vaccine continues to perform well. The question on the table is in what degree? Now, J&J has accounted for roughly about 10% of all of the vaccination that's occurred in Maine. So it won't be the same numbers that we see for Pfizer or for Moderna, but the early data that I've seen and that I've been briefed on suggests that getting a booster of the J&J vaccine takes what is already a good performing vaccine and amps it up even more. That meeting from the FDA is occurring in 11 days on October 15th. I'll be eager to hear what the FDA and then later the CDC think.
Dr. Shah, I know that the numbers that you have been able to provide for the people of Maine about COVID-19 positivity rates have had a little bit of a lag because of testing delays. And I'm wondering where we stand on that. Have you been able, have the labs, has your lab and have other labs been able to catch up?
So testing remains a challenge statewide, Jen. Our lab here in Augusta, the Maine CDC laboratory, is really one that we've reserved for outbreak situations. So for facilities, long-term care facilities, hospitals, other facilities that are experiencing an outbreak, we want our lab to be immediately available and turn test results around within 24 hours, which is our goal, so that facilities that are in extremis, in an outbreak situation, can get rapid answers really quickly. And that's really what we've reserved our laboratory for right now. But that means that for those who might have a bit of a sniffle, to say nothing of those who might be planning a trip across the border, finding testing has been a challenge. We've acknowledged that, and we're doing more to try to bring more testing online. Unfortunately, testing across the country has been a challenge. We've made some strides by doing a couple of things. The first is we announced on Friday an expansion of our efforts in partnership with Walgreens. Walgreens, every Walgreens in the state now will soon be offering PCR testing, which is a big step forward, again, particularly for those who want to travel somewhere and need the precision that a PCR test offers. But Walgreens is now routinely offering the rapid antigen test, the so-called Binax Now test. We recently secured 35,000 more of those tests that we're sending not just to Walgreens, but to schools and other places. But make no mistake, testing remains a challenge. We've heard loud and clear that folks are having difficulty accessing testing. And then when they do access it, difficulty in getting timely results. We're committed to making more strides in making testing more widely available. It's been a challenge, but we're not stepping off the gas.
All right. We have so many questions coming in from our listeners. I'm going to go to some of those now. We're going to start with an email. This is coming in from Jean. What is currently considered safe for vaccinated people who live with unvaccinated children or elders? Should we refrain from flying? What about gatherings with others who are also vaccinated? Considering that we seem to be in for a long haul, how do we stay safe and still participate in life?
Yeah, Gene, that is a really the perfect question to kick off our discussion today, because on one hand, we all want to stay safe and keep those who we love around us equally safe. At the same time, COVID may be with us for a while, albeit in different forms as the pandemic evolves. And so we've got to make sure we stay connected and get on with the things that make life worth being in Maine for in the fall and getting out there and enjoying ourselves. There are a couple of guidelines that I think might be useful. The first is a gathering of entirely vaccinated individuals who don't have other health conditions and, for example, don't live with folks who have pre-existing health conditions. If a group is gathering and they're entirely vaccinated, that is by and large a very low risk event. You then move up the scale as you start removing some of those constraints in that hypothetical. If some folks, but not all folks, are vaccinated, the risk level goes up. If some folks, but not all folks, have pre-existing health conditions, the risk level goes up. The same steps that we've recommended that folks take throughout the pandemic apply now in the same way that they did before. If an activity can be moved outside, that's the first best thing you can do. If an activity needs to be indoors, having folks mask up is the second best thing you can do. In addition to that, things like encouraging ventilation if you have to be indoors, trying to keep people spaced out, as well as to keep the event as short as possible, are all things that you can do to keep things that much safer. There's not a magic bullet right now. And unfortunately, for some folks, getting out there, going to that event is going to take primacy over other things. My recommendation is to try to do the things that are important to you, but to do so in the safest manner possible, either by thinning out the number of folks who are there, making sure folks are vaccinated, wearing a mask, increasing ventilation.
All right. An email here from Brad. Maine and Connecticut have almost identical vaccination rates, but case rates in Connecticut are significantly lower. Can you comment on the disparity in case rates?
The case rates in Connecticut are a bit lower than they are in Maine, but not necessarily demonstrably so. What I mean by that is what's driving the difference in transmission patterns in, say, well, we'll go back to Iceland versus the UK. What accounts for the differences there is the following. It's not just the number or percentage of people who are vaccinated, it's the distribution of where those individuals are. Consider two hypothetical states that are identical in every way, with the exception of thus. In one state, 2 out of every 3 people in every household are vaccinated, right? Across the state, for every household, 2 out of every 3 people that live there are fully vaccinated. In that situation, even if you had a virus, it wouldn't have much room to run, because every single place it went, every single household it went to, the majority of people would be vaccinated. Contrast that with another state, where there too, 2/3 of the entire state are vaccinated. But rather than it being homogenous, 2 out of every 3 people in every household, it's heterogeneous. That is to say, 2/3 of the entire southern part of the state are vaccinated, but the remaining top third or western third is unvaccinated. There, the structure of vaccination is much different. And because of those pockets of unvaccinated, you can still have the same virus run rampant there. Whereas in the other state, where 2/3 of every household are vaccinated, it wouldn't even get a running start. That's a large part of what's going on in states like Maine, as well as other rural states. We have pockets of unvaccination, and that's where most of our cases, most of our transmission, and many of our outbreaks are originating. Whereas in other states, like, for example, the country of Iceland, it's very homogeneous compared to the UK, which looks more like Maine in terms of its pockets.
We have several related questions, and I'm going to read two of these, Dr. Shah. One, both of these are from Facebook. Here's Gary. Would love to know the virus load that the vaccinated can carry versus the unvaccinated, or are unvaccinated more contagious to others? And Susan, I was told by someone who works for a health insurance company that if you're vaccinated, infected, and asymptomatic, that you can be as contagious to others as those who are not vaccinated. Is that true? And again, several others.
Gary, Susan, and others, that is such a great question. Let me take it head on. There has been some incorrect reporting of a very difficult topic that has generated this notion that is incorrect. That notion that is incorrect is as follows. The notion is that vaccinated people can transmit COVID just as easily as unvaccinated individuals. Please allow me to put this to bed right now. Vaccinated individuals can, on occasion, transmit COVID, but that pales in comparison to the rate at which unvaccinated people can get and transmit COVID. Estimates vary, but it's anywhere from 20 to maybe 100 times more likely that an unvaccinated person will be getting and transmitting COVID as compared to a vaccinated person. Vaccinated people can, on occasion, have the virus in their nasal passages and can, on occasion, get sick, what we call a breakthrough case, and can, on occasion, transmit that illness to somebody else. It can happen, it does happen. But what happens many fold more commonly is that unvaccinated people have the virus, get sick from the virus, and transmit the virus. So we're not talking about possibilities here, we're talking about degrees of likelihood. And what is much more likely every single day of the week is that an unvaccinated person is the one that's out there transmitting COVID.
We are talking with Maine CDC Director, Dr. Nirav Shah, on Maine Calling. We're going to take a quick break. We'll have more of your questions for him right away. We'll be right back.
Listener support brings us Maine Calling, with help from Eastern Basements, a division of Maine-owned Eastern Mold Remediation, offering basement waterproofing solutions. EasternBasements.com and the Finance Authority of Maine, helping Maine people achieve their business and higher education goals since 1983. FameMaine.com. We invite you to join us for Maine Public's Dash of Maine Masterpiece Cooking Challenge. Do you have a favorite recipe that everyone loves? Send it to us along with a picture of the completed dish to enter the challenge. But that's not all. We want to know which masterpiece character you've made the dish for and why. Maybe a favorite rum cake for Inspector Morse to lighten him up a bit, or a beans and franks casserole for Lady Mary so she can see how the other half lives. We'll pick 2 winners each week. Visit mainepublic.org for all the details. Maine Public is seeking new applicants to serve on our Community Advisory Board. The Community Advisory Board serves in an advisory role to Maine Public's Board of Trustees and staff. It consists of between 15 and 20 volunteer members from around the state who meet twice a year to offer feedback to Maine Public on a variety of topics, including content, programming, audience engagement, and membership. For more information and to apply, please visit mainepublic.org/CAB. Please note that the deadline to apply is October 10th. Thank you for your interest.
And welcome back. I'm Jennifer Rooks. You are listening to Maine Calling. Today, Dr. Nirav Shah, Director of the Maine CDC. He is answering questions about COVID-19 and what is happening statewide with the resurgence of the pandemic. You can share your comments or questions by email, talk@mainepublic.org. You can find us on Twitter, Facebook, or Instagram, or give us a call 1-800-399-3566. Also, you can view today's conversation with Dr. Shah. The live stream is available on Maine Calling's Facebook page or by going to Maine Public's YouTube channel. We're going to go to Judy, who's calling from Belfast. Hi, Judy. Go ahead. You're on Maine Calling.
Hi. My question for Dr. Shah is in regards to the effect of the booster for people who have immune suppressed conditions. My husband has RA and takes immune suppressing medications, and I wondered how much more protection we can expect him to have right now. And I'll take my reply off radio. Thank you.
Thanks, Judy. That question has certainly come up, not just in connection with, say, RA, your husband's condition, but individuals who have a variety of other medical conditions, whether it's because they're being treated for cancer or they've got an organ transplant or a host of other medical conditions. It does vary condition by condition, person to person. But in general, what we've seen in the data is that the third dose of either the Pfizer or hopefully soon the Moderna vaccine, that third dose does push up the body's immune system's ability to fend off the virus. Will it ever achieve the rates that it would have been but for that medical condition? It's too early to tell. But the data that I've seen or that have been presented to me by the US CDC were quite encouraging. That third dose really does seem to rev up the body's immune system, particularly in those for whom they are contending with a pre-existing immune system condition. So that's why we're focused on getting folks that third dose or that booster shot if they need it. At the same time, though, Judy, while I'm hoping your husband and everyone who's eligible gets their booster shot, we're just as focused on the first doses as we are on third doses. From a public health perspective, not an individual perspective, but a population perspective. It's those first doses that are really going to help us find our way out of the pandemic. Third doses are undoubtedly important on an individual level, but from a population level, I'm talking globally, it's getting as many people as possible on that first step toward immunity through vaccination. That's really what's going to be the game changer. And so our agency is just as focused on getting more first doses into arms as we are getting third doses.
We'll go to June, who's calling from Caribou. Hi, June. Go ahead.
Yes, hi. Israel and Maryland right now are working on patenting a strain of full flower sativa, but it's for profit. And I'm wondering how we can advocate for the government to test a non-patented strain of sativa as a treatment for COVID, because there's a lot of research, including NIH research, that shows that cannabinoids calm the cytokine system, which is what the treatments like steroids do, but with an awful lot of side effects. And the new treatment you discussed at the beginning of the show, they've warned that it can cause genetic mutations. So if our government could test this, a non-patented strain, and could come to some good conclusions using it as a treatment, that's something that could be shared across the planet, and everyone could just grow it themselves. An article to refer to is the NIH article called The Cannabinoid System and the Cytokine Network, where it shows there's a complete connection with our brains. And this is research that has come out in the past 10 years.
Sure. June, thanks for your question. I'm going to let Dr. Shah respond. Go ahead.
Sure, June, you're right insofar as the cytokine system is responsible for some of the body's own response to COVID itself. It's way too early to tell whether any of the other treatments that are out there, for example, cannabinoids, will show long-term efficacy in the treatment of COVID. The early studies, and they've all been early, have not really shown much promise. That's not a reason to abandon that line of research, but it's a reason to go into it with caution. One of the things we've seen with respect to COVID is that a lot of treatments that were heralded early on didn't really pass muster when the exacting standards of double-blinded, placebo-controlled, randomized clinical trials were applied to that, whether it's hydroxychloroquine, ivermectin, vitamin D, so many others. It's unclear what direction sativa and cannabis will go, but the early direction suggests that other more established therapies like monoclonal antibodies and vaccination are really going to be the promise.
June, thanks for your question. Going to go to Kimberly on Facebook, who says or asks, would the booster shot likely create more or less similar reaction to the first shots? Additionally, is there a prime window for the booster? Meaning, is that between 6 or 8 months after the second shot, or is the window larger to maintain a base level protection for those interested in boosters?
Great. I'm going to take that second one because that is really critical, although I'll answer the first as well. But that second question about timing is really important. I'm glad you raised that today. There is this notion out there, because of how much boosters have been discussed, there is this notion that after 6 months, the day 6 months after you got your second dose, your protection goes from 80 or 90% all the way to 0 on that morning 6 months after your second dose. And that's not true. Boosters are something that you should do this fall as part of the normal preventive health that you should also always be taking, whether that's going to get your flu shot or checking in with your physician about yearly diagnostic tests that you might want to be doing. Boosters are important, but you don't need to mark the calendar to the day and time 6 months after your second shot out of fear that if you miss that day or even that week, your protection rate will have fallen to 0. The vaccines continue to hold up. So boosters for me are something you should walk to get, not necessarily run to get. The optimum window is not 100% clear, but sometime after your 6 months is the time to go. You probably don't want to stretch it too many months thereafter that. But again, it does not need to be a medical emergency the morning 6 months after your second shot. In terms of the side effects from boosters, the US CDC published some data about a week ago on the preliminary experience with folks who have gotten their booster. And basically, the side effects that they experienced were about on par with what folks experienced after their second shot, which is to say some pain in their arm, maybe a little bit of soreness, maybe they felt crummy for the day after they got their third shot. But actually, a lot of folks who got a booster didn't feel anything at all. So the side effects, though they may occur, are not going to be different from what you experienced already, and they may not even occur at all.
An email here from Todd. I have a trip to Japan scheduled in late January. I received the J&J vaccine on March 27th. I understand Japan does not recognize the J&J vaccine. I am wondering, is it safe for me to receive the Pfizer, Moderna, or AstraZeneca vaccine before my scheduled trip?
Okay, Todd, that's a great question. What you're referring to or asking about is what's been colloquially talked about as a mix and match strategy. You got Moderna first off back in March or April. Now it's time for, can you get Pfizer for your, or Todd, in your case, J&J early on, can you get another dose of, say, Moderna? It's too early to tell. Right now, National Institute of Health is doing a massive study to figure out how all of these pieces might fit together. Indeed, the US CDC is slated to get an update, FDA is slated to get an update on that study in about 10 or 11 days. It's too early to tell, Todd, and thus I can't make any recommendation for you. But your trip is in the end of January. And generally speaking, boosters take anywhere from 10 to 14 days to really start working. Now you got your J&J shot at the end of the end of March. So you're probably coming online for a time at which your booster might need to be something you should get. But as I mentioned in connection with the last caller's question, it's not going to be a medical emergency. And there's a good chance that by the time your trip to Japan comes around at the end of January, we'll have a lot more clarity around what your booster situation will look like. Indeed, we may have that clarity even by the end of this month or into next month. And it may be the case that, as Jennifer noted at the top of the call, the best booster for you is just going to be another shot of J&J. Time will tell.
All right. So we're going to go to Marty, who's calling from Portland. Hi, Marty. Go ahead.
Hi, Jennifer, and hi, Doctor. It's a pleasure to be here. A quick question. Just in general, when you have meetings of people like in a church, or I'm a member of AA, and we have meetings, and I'm just wondering, what are the guidelines for like masking? We recommend it, but it's not required. Spacing of people in the room, should we go back to the 6 feet apart? What are your just general recommendations on how people can stay safe? And are you vaccinated or not?
Great. Thanks, Marty, and congratulations to you. Here's what I recommend to folks, and indeed, here's what we do at the Maine CDC. Where having a meeting inside is something that needs to happen, where we can't move it outside, where we can't have a walking meeting around the block. We try to do a few things. The first is to have folks spaced out as much as possible in the room. The second, and you mentioned it, we ask folks to wear a mask inside. And the third is we try to bring as much airflow into the room as possible. Open up the windows, try to have the doors open so there's much cross flow of air to reduce the likelihood that if someone does have COVID, if they emit it, it's hanging in the air for others to breathe in. So I think those are really nowadays, Marty, the mainstays of indoor prevention. Keeping spaced out, having everyone wear a mask, and increasing the ventilation as much as possible. Those 3 bedrock principles help keep folks safe. The more folks who are vaccinated, the risk goes down commensurately from there. But of course, in a meeting like the one you're describing, you don't want to go putting preconditions on who can come. You want to, of course, keep it as open as possible. And that's why I think keeping folks spaced out, masking, and airflow are the steps to make those indoor gatherings and meetings as safe as possible.
Marty, thanks for your question. We have a lot of questions about boosters coming in, Dr. Shah. Several people wondering when people under 65 will be eligible for a booster of Pfizer.
The data that were presented in connection with the boosters themselves showed 2 really stark things. The first was that around the age of 65, the effectiveness of the vaccine started trailing off, particularly for those who were, say, in a nursing home. But the other thing the data showed was that for those younger than 65, the protection afforded by the vaccine still remained robust. Now, it may have come down a few percentage points, but even the Delta variant didn't really erode that significant protection. Again, it came down a little bit. But the thing to keep in mind with the vaccine is that the vaccines we're talking about, Pfizer, Moderna, and J&J for that matter, they go into this with extremely high effectiveness rates, 80, 90%. And in the vaccine world, those are numbers that are frankly unheard of. That's how good these vaccines are. Even if something that is 90% effective falls just a few percentage points, it's really, really darn good. I mean, it's a little bit like an Olympic high jumper who clears the bar with 3 or 4 feet to spare on their first jump, but on the second jump only clears it with 2.5 feet rather than 3 feet. They still blew through what everyone's expectations are. That's how good the vaccines are, particularly for those who are on the younger side. Now, federal health authorities and academic researchers are keeping tabs on this because the passage of time may in and of itself diminish some of the protection afforded by the vaccine. And if that happens, when that happens, it's probable that those under the age of 65 will need to get a booster. But right now, based on where we are today, we should all be thankful the vaccines are offering great protection. Will that be the case forever? No. It's probable that those under 65 will need a booster, but it's probably a ways off. And
an email
just to put a finer point on that, that's not a bad thing. That is because the vaccines continue to perform well.
And an email from Marie, any sense of timing for Moderna booster?
Soon. And I can't get more specific than soon, but the US FDA is going to be reviewing the evidence on the Moderna booster in about 11 days. So this month. Usually the US CDC convenes shortly thereafter to provide clinical recommendations around the scientific data that FDA has reviewed. So it's possible that we'll be seeing Moderna boosters, I think in weeks, not months.
All right. Well, we are going to take another quick break. We're speaking with Maine CDC Director Nirav Shah. This is Maine Calling.
Listener support brings us Maine Calling with help from A Family for Me, a Spurwink program committed to raising awareness of the need for foster and adoptive parents. Learn more at afamilyformemaine.org. And the Lunder Foundation in support of the Colby College Museum of Art, who are bringing the museum to you online at colby.edu/museum.
I'm Scott Tong. The internet is one global thing, right? Actually, a new book argues there are 4 competing flavors of it around the world, and that may just be how things are.
What we've got to do, ideally, is keep the internet going while still leaving everybody space to do their own thing online, even if we don't like it.
That's next time on Here and Now.
Here and Now, coming up shortly after Maine Calling from 12 noon until 2 here on Maine Public Radio. There's a lot going on here in Maine: concerts and classes, lectures and literature, fairs and festivals. How can you connect to it all? Maine Public's community calendar is here to help. It's easy to find things to do. Search by type of event, date, or location. And if you represent an organization and want to let Mainers know about your event, it's easy to enter the details on our online form. Maine Public's community calendar. Bring the people of Maine together. Visit mainepublic.org and click on Events.
And welcome back. This is Maine Calling. I'm Jennifer Rooks. Joining me once again, Dr. Nirav Shah with the Maine CDC, updating us on the latest pandemic news and recommendations. Call 1-800-399-3566. If you're very quick, you can send a brief email to talk@mainepublic.org or find us on Twitter, Facebook, or Instagram. And if you'd like to watch a live video of today's program, go to Maine Calling's Facebook page or to Maine Public's YouTube channel. We're going to go to Jeff, who is calling from Wiscasset. Hi, Jeff. Go ahead.
Yeah, thank you, Dr. Shah. I just wanted to get some clarity on what data you are referencing to talk about the effectiveness of vaccine in terms of acquiring and spreading COVID-19. And if your data is right, how does it explain like what's happening in Israel, where they have a high rate of vaccine and still a high rate of transmission? And is your data including legacy data, or is it out on the leading edge of what's happening with COVID? So in other words, are we talking about averages, or are we talking about what's happening in the moment with vaccines or and vaccine efficacy, for that matter?
Sure. So Jeff, the data that we typically look at for these situations is usually that which is compiled by the US CDC. Much of these data were presented at a public meeting that they had around about 2 weeks ago now to review all of the data around the Pfizer vaccine and boosters for Pfizer vaccine. And specifically, there was a presentation that was there. All of this is publicly available, including the slides, which reviewed the various efficacy pieces around all of the vaccines, and particularly their ability to reduce the likelihood of infection, transmission, hospitalization, and sadly death. The data, of course, in any pandemic, there is a bit of a lag. In no situation do we have data around things like efficacy that are to the minute. Sometimes they are a couple of weeks behind, sometimes even a bit more. And the question, of course, is, has something changed in that time period to render those findings immaterial or inapplicable? And right now, the big thing that's changed is the Delta variant. And so when we take a look at vaccine efficacy data, we take a look at the pre-Delta period, and we take a look at the post-Delta period. And then the other variable is that we always try to control for time since vaccination, to try to control the effect of passage of time. Israel comes up quite a bit. And although there's a lot to be learned from Israel, given how well they've done at collecting data, dare I say, perhaps even better than the US, it's also important to point out where there are differences. Israel, when much of those data were collected, was not in the same state of vaccination as, say, Maine is right now. That's why I found a bit more education and analogous findings from looking at data from places that are somewhat more on equal footing, as is Maine. But even then, the vaccination rates in Israel, although they started off quite small, they too ran into a wall and found pockets of folks who were unvaccinated, generating largely the same spike in cases that we've seen in Maine. So I believe it's instructive. Vaccines do not confer immortality. They confer immunity. And immunity is not a given. There can be breakthrough cases. And indeed, the more folks you have who are vaccinated, the more breakthrough cases you'll have.
Jeff, thanks for your call. And I'm going to ask you a related question here. And I think that this, Dr. Shah, you're going to want to answer because it's going to clarify how data can be misread or misinterpreted. This is from Robin. I am vaccinated and getting my booster shot next week. I was alarmed. This is what Robin writes. I was alarmed to read in the Bangor Daily News last week that 30% of vaccinated people were in ICU units. Is that correct? And clearly that can't be correct because we have hundreds of thousands of vaccinated people in Maine, and we don't have hundreds of thousands of people in ICU units. So why don't we talk about what is that 30% number that Robin read?
Yeah, so I'm glad you mentioned this, Jennifer, and you're right. There are, the statistics get tricky, and sometimes if we're reading quickly, it's difficult, or it can be easy to read something and be left with the wrong impression. The statistic that you noted said that 30% of vaccinated people were in the ICU. It's not that, it's the opposite of that. It was at a point in time last week in the ICU at Eastern Maine Medical Center. 30% of the people in the ICU happen to have been fully vaccinated. Now that number fluctuates quite a bit. It ebbs and flows as the composition of who's in the ICU changes. But you can immediately see the difference between 30% of people in Maine who are vaccinated being in the ICU. One is a number, the other is a rate. 30% of people in the ICU are fully vaccinated. This stuff gets bewildering. Probably 8 to 10 times a day, I make a mistake in thinking I thought one thing, but someone on my team catches me. It's a reminder for all of us to just sort of gut test every type of statistic you see. Just ask yourself if it squares, because there are so many numbers flying around right now. It's a good reminder for all of us to just pause and not rush or jump to a conclusion.
And so probably the reality was, and tell me if I'm wrong, that at some point last week, there were 4 or 5 people in the ICU at Eastern Maine Medical Center who had been vaccinated.
You are correct. That is the right interpretation of those data. In general, over the past several weeks, about 90% of the people in ICUs in Maine were not fully vaccinated. But from time to time, that number can change because the overall number we're talking about is pretty small. Right now, for example, in Maine, just as a comparison point, thankfully, there aren't that many people in the ICU, 62 as of this morning. A few people up or down can make a big difference in percentage terms. And so anytime you hear a percentage, it's always a good practice to say, in real terms, in real numbers, how many people does that mean?
All right, an email here from Beth. I'd like to ask Dr. Shah about childcare facilities and preschools. Given the proximity of caregivers to children and the excessive body fluids present, she's talking about body fluids from noses and tears. I'm curious if Dr. Shah feels the option for teachers of being tested as an alternative to being vaccinated adequately protects our children and teachers. I worry that not enough attention is being paid to this field. Exposure is akin to those of healthcare workers with untested patients. And we do have other questions from parents who may assume that teachers caring for our kids are vaccinated, and the reality is not all teachers are vaccinated.
Well, let's start there, Jennifer, which is thankfully the numbers of teachers who are vaccinated is quite high. So it's not as if in Maine we are facing an epidemic of unvaccinated educators or childcare workers. The numbers statewide, as reported into DHHS, are uniformly quite high. And so my hat goes off to educators and teachers for doing the work of getting vaccinated Many of them got vaccinated early on, way back in March. But that being said, it's not 100%. And so for those teachers, childcare workers who are not vaccinated, the question is whether that weekly testing option is sufficient to protect them and to protect those they work with, especially in light of the Delta variant. Well, some degree of testing is better than no testing, but given the contact that they've got, I still believe that getting vaccinated is still the safer route than, say, weekly testing. Weekly testing is good, it's helpful, but as you noted, and as the emailer noted, given the high degree of interactions that they have, vaccination trumps weekly testing in this particular situation, certainly in the healthcare field, but I think also by extension in the childcare field as well.
All right. An email here from Lucy. Please talk about the risks of large gatherings like the Freiburg Fair. I was going to be a vendor there this year, but I decided not to because I think it's too risky. So many people are coming from different parts of the country in such large numbers.
Well, Lucy, risk is one of these words that we've grown so accustomed to, and throughout the pandemic, and we've grown accustomed to thinking about risk as an absolute measure, something and almost a binary one. Something is either risky or it's not risky. And the truth is that, like all things when we talk about risk, it exists on a sliding scale. And one of the variables on that sliding scale is your own personal profile, your own health conditions, your own tolerance to take risks. And so for something like being a vendor at the fair or going to an outdoor concert, is it zero risk? Of course not. There is nothing right now, nor has there ever been in recorded history, any activity that is zero risk. The question is it an acceptable risk for you, your family, and your community? Thankfully speaking, outdoor events like the fair have not been seen as major events for transmission. I'm not saying transmission hasn't happened. I'm not saying it can't happen. It definitely can. It definitely has. But relative to indoor events, the risk of transmission is far greater and continues to be lower. Now, as we go into the fall, that leaves some question marks open. But here's the thing, everyone. We've done this before. We had this conversation last fall and last winter, and we made it through. Mainers have shown that we can do hard things and even do multiple hard things like once, like balancing all these risks and moving forward.
All right, we're going to go to Yarmouth and Bill. Hi, Bill. Go ahead. You're on Maine Calling.
Thank you, Doctor. I read the New York Times every day. They have a daily map that shows hotspots by states. And I see now for the past 2 weeks that Maine is more of a hotspot than Arkansas, Louisiana, or Florida. Should that be a concern?
Well, Bill, I too take a look at a lot of those data. And some of what's going on there is the way that a lot of those graphs are tabulated is based on relative numbers of new cases over the last 7 or 14 days. And what's basically happened is the virus has been working its way northward. And so while Mississippi, Alabama, and Georgia have tailed off, Maine, Vermont, New Hampshire, Massachusetts are starting to heat up. It's a bit like a carousel. One set goes down, but the other set goes up, or kind of like squeezing a balloon a little bit. Is it a cause for concern? Absolutely. The team here at Maine CDC has been laser focused on things like hospitalizations, getting a hold on where the virus is going, as well as increasing vaccinations. So it's definitely something we've been concerned about. But the reason it's happening is a bit of this carousel effect. The virus makes its way across the land, and as some places go down, other places go up. It's unfortunate. Scientists decades from now will sort out why that happens. We do see it with other respiratory viruses, whether it's the flu or another one that affects kids called RSV. And right now, unfortunately, the Northeast, it's taking its turn in the hot seat.
Bill, thanks for your question. Email from Jim. Of breakthrough cases in Maine, is the CDC tracking what percentage are Pfizer vaccinated, Moderna vaccinated, and J&J vaccinated?
We have some of those data, but the intuition behind the question is that knowing that is a way to track vaccine efficacy. And that's actually not how vaccine efficacy is tracked. Vaccine efficacy is not a function of breakthrough cases. It's a function of I don't want to get too into the math, but the relative risk of different vaccines. And so it's not tabulated by simply looking at breakthrough numbers. The reason is that those numbers can be highly misleading. For example, the Pfizer vaccine was the first one offered. The J&J wasn't offered for 3 months thereafter. So we might see numbers that don't actually tell us the full story. To your earlier question about interpreting statistics correctly. That's why vaccine efficacy is not tabulated by simply what percentage of breakthroughs were vaccine A versus vaccine B. It's a completely different set of mathematical calculations. And that way we control for things like time since vaccination, so we can adjust for that and not be dissuaded by the facts. Miss
An
West.
email here from Nancy. My husband and I are in our 80s. We'd like to visit our daughter in San Francisco. What do you recommend about flying now?
You know, Nancy, kudos for you for wanting to go visit your family. I would recommend a couple things. First, you're eligible for a booster. I'd go get your booster. While you're getting your booster, I'd go get your flu shot. If you haven't gotten it yet, you can get them both on the same day. You can get one in your left arm and one in your right arm. I would do both of those things. The second thing is with respect to flying. Thankfully, flying has not shown to be the risk that a lot of folks thought or feared it might be early in the pandemic. Everyone on a plane has to be masked. That's a good thing. Everyone in the airport has to be masked. And then indeed, on top of that, planes have extremely high efficiency circulation and filtration systems, which reduce the likelihood of exposure or contracting COVID. Is flying zero risk? No. There's still the possibility of getting exposed while you're in the cab at the airport itself, or while you're waiting for your bags. So it's not a zero risk venture, but the plane itself is a bit lower risk. The question is minimizing the risk of all of those attendant activities so you can make that trip safely. If you determine you can't do that safely, then it may be something you have to hold off on a bit longer. But get your booster first of all, and then make your plan steps accordingly.
Well, Dr. Shah, as always, thank you so much for joining us and taking questions today. Nirav Shah, Director of Maine Center for Disease Control and Prevention. Today's sound engineer, Sandra Harris. We had help from Nick Woodward, Nick Godfrey, and Andrew Catalina. And Maine Calling is produced by Jonathan Smith and Cindy Hahn. This show will re-air tonight at 7. Visit mainecalling.org for more information about our programs and to sign up for our podcast. Tomorrow on the program, Entrepreneurship in Maine. I'm Jennifer Rooks. This is Maine Calling on Maine Public Radio.